Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for the United States. As we've said before, the U.S. was relatively unaffected until early March. Even then, it grew fairly slowly until the beginning of April, and then began to grow quite quickly after that. This is deaths, total number of deaths, such that by last Thursday, 191,000 deaths and over 6 million confirmed cases, a 3% increase in the last week alone. I always like to remind folks of the top 10 causes of death in the U.S. 3/4 of all the deaths in our country are attributed to one of these 10 causes. And in 8 months, i.e. through the end of August, this is what we would have expected. COVID-19 at the time had 187,000 deaths, placing us solidly third, the third leading cause of death in the United States. So it is a major pandemic and a growing problem. In terms of cases, we grew quickly, slowed down, then grew again, and it's been slowing down since then. But I don't like to use cases because cases reflect how many tests are done. I prefer to look at deaths. And again, early on, there was a quick increase in deaths. It slowed down, went back up, and now appears to be creeping back down again. And again, as I said before, think of this as multiple pandemics, multiple epidemics spreading across the U.S. So this is the pattern of growth in the U.S. There's states like Florida where it's growing quite quickly, Tennessee where it's growing but not as quickly, Virginia where it seems to be slowing down, and then states like New York, New Jersey, Massachusetts, Rhode Island, which appear to have reached their maximum. One of the ways to think about this is the percent week-to-week increase. So early in the pandemic, we were almost doubling every week. The number of deaths were doubling, 90%. And then it slowed down, and it's been coming down fairly gradually, but consistently since then. And as I say, in the last week, it's been a 3% growth rate. And this is reflected in the fact that the pandemic started in the Northeast. This is all the cases that in the U.S., the darker counties are where the most cases were, and then in the purple is the cases in the past 2 weeks. And you can see it's no longer impacting Northeast quite as heavily, now impacting the Midwest and the South as well. So think of this as multiple pandemics, just like ripples in a pond. It's not over. It's slowing down in some parts of the country. I expect that we'll see slowing down in our part as well eventually. But it's still a major pandemic. It's still a leading cause of death. It's still a major public health problem. There's a great deal more information about COVID-19 on the College of Public Health website. If you go and click on this icon, it'll take you to multiple other videos. If you know anyone who would like to be added to our mailing list, please have them contact Jan Stewart. I'd like to thank Melissa White for updating this week's slides and Dara Young for editing, producing, and posting these videos. If you have any questions or would like have any comments or have any other topics you'd like to see us cover, please let me know. I'd look forward to hearing from you. Thank you very much.